Michaela is a 14-year-old female who is experiencing symptoms of asthma. She came in with symptoms of shortness of breath, wheezing, tightening of her chest, and a dry cough. In the following video, she will have an allergy test performed, and the medical assistant will explain to her 2 different types of inhalers and also explain to her how to use them. Hi, Michaela. My name is Lauren, and I'm your medical assistant today. How are you feeling today, and what brought you in?
Hi, Lauren. So I've been having some breathing issues lately, and I'm kind of worried about it.
Okay. Well, don't worry about it yet. We can run a few tests and hear about your symptoms just to try to figure out what's causing these problems.
Okay, sounds good.
Okay, so what are some things that are going on?
So I've had a cough lately, and it seems to be getting a little worse. Wheezing may be a little better of a word to call it. My chest feels tight, and I get shortness of breath.
Okay, does this get worse around nighttime?
Yes.
Okay. Does this get worse around certain times of the year or around anything specific?
Yeah, so my allergies seem to set it off, and sometimes when I'm around my neighbor's dog.
Okay. Well, it sounds like you might have asthma, but we'll have the doctor do an allergy test on your arm just to make sure you aren't allergic to anything like pollen or pet dander. These things are common triggers for asthma or asthma attacks. Does exercise play a factor into it getting worse or causing any of these symptoms?
Yes, so in PE class, we are learning to run the mile.
Okay.
And it gets worse, especially outside in the cold.
Okay, so temperature plays a part in this. So the temperature makes it worse or triggers a tight chest, shortness of breath, anything like that?
Yes, both.
Okay. Does anyone in your family smoke?
Yes, my aunt and my cousin.
Okay. Are you around them often?
Yes, we do family dinners on Sundays.
Okay. Do your symptoms get worse around when they're smoking?
Yes.
Okay. Do they smoke inside the house or anything like that, or where do they normally smoke?
They don't smoke inside of the house.
Okay.
They'll step away and smoke outside of the house.
Okay. When they come back in, does that normally trigger anything?
Yes.
Okay. Well, tobacco smoke can be a trigger for asthma or asthma attacks. This is also on your allergy test. So just to make sure it isn't just because you don't smoke that's causing you to cough, we'll test that as well.
Okay, sounds good.
Okay. Michaela, your doctor will be in shortly to do your allergy test.
Okay, thank you.
Okay, Michaela. How was that?
It was okay. It was a little weird, but not too bad.
Okay. Well, actually, your allergy test did come back saying that you were allergic to pet dander, pollen, mold, and tobacco smoke.
Okay. No. So what should I do about that?
Okay. Well, not to worry. It doesn't seem to be a very severe case of asthma. I'll talk you through how to use your inhaler when it's for your chest, for when your chest gets tight and it's hard to breathe. And we'll discuss some of the medications that you could use if things get worse and your inhaler doesn't seem to be working hard as well.
Okay.
All right. So there are 2 types of inhalers. We have a reliever and a preventer. Our relievers are kind of for an instant relief. So if you are like getting to a point where you feel like you're having an asthma attack, you'll use the inhaler and it'll disperse its medication and it'll help you. It's not long term. It's just for immediate cases. But the preventer is an inhaler that you take daily in the morning or night, depending on your schedule or whatever. And it's got a medication in it, and so it'll work slowly over time, about a few weeks, about a month, it'll start to kick in, and you'll start to feel relief for that.
Okay.
All right, so those are the 2 different types of inhalers. Do you know how to use an inhaler?
I do not.
Okay, so what you're going to do is it looks about it like in a little L shape. So you're going to hold it, the mouthpiece, place it in your mouth, hold down the top button or the canister, you'll press down to start dispersing the medication. You'll breathe in, hold it for about 10 seconds. If you can do 10 seconds, sometimes people can't, but about 10 is going to be the best amount. And then after that, you should start to feel relief, and it'll help you breathe a lot easier. Do you think you can do that?
Yeah.
All right. Well, I'll call that in for you, and I'll see you at your next checkup.
Okay, thank you.
Thank you.